The topic today that we are going to discuss is the bacteria Streptococcus. We will be dividing this bacteria in 6 basic categories. The first being the introduction, the second being the culture media, virulent factors, clinical manifestations, the investigation, or you can say diagnosis, and the last one is the treatment, or you can say the drug of choice. So our whole lecture will revolve around these 6 things only. Now coming to the basic introduction about the Streptococcus is that it is a gram-positive bacteria. It stains purple on gram staining. It's basically arranged in chains. As you can see, it's arranged in chains, and the third one is its catalase negative. These things are the basis of these Streptococcus: gram-positive, arranged in chains, and catalase negative. And we classify these Streptococcus on the basis of Brown's classification. The Brown's classification is based on the fact of the hemolysis that the bacteria does in blood agar. So, hemolysis that the bacteria does on blood agar, we classify the Streptococcus in 3 basic categories. The first one being alpha hemolysis, the second being beta hemolysis, and the third being gamma hemolysis. So in the alpha hemolysis, there is partial hemolysis. And in beta hemolysis, there is a complete hemolysis going on. And in gamma hemolysis, there is no hemolysis. Coming to the alpha hemolysis, that is the partial hemolysis, we have two bacteria that follows these partial hemolysis. The first being Streptococcus viridans, and the other one is Streptococcus pneumoniae. Now coming to the beta hemolysis part, in which there is complete hemolysis, we further categorize these on the basis of the carbohydrates in the cell wall, and it's also called as Lancefield classification. So these beta hemolytis bacteria are further divided into 21 types on the basis of carbohydrate in the cell wall, and these classifications of bacteria are called as Lancefield classification. And in this classification, there are 21 types of bacteria named according to the alphabet starting from A, and it goes up to letter W. So it comes up 21 types, and starting from A, B, C goes up to letter W. Very important thing to note is that there is no alphabet I and J. So I'll write there is exception of letter I and J. So in alpha hemolysis, we have Streptococcus viridans and Streptococcus pneumoniae. In beta hemolysis, we have group A beta hemolytics, group B hemolytic Streptococcus, and in gamma hemolytics, in which there is no hemolysis, we have Enterococcus. So we will be discussing these these three, that means the Streptococcus, Virulence pneumoniae, and Enterococcus. And from beta hemolysis, we will be discussing group A and group B only. In today's lecture, we will discuss only group A beta hemolytic Streptococcus. So let's start about group A beta hemolytic Streptococcus. So we'll write this as GAP, and you should know that this bacteria has a common name. It's known as Streptococcus pyogenes. So discussing these group A beta Streptococcus, we will follow our same template, that is introduction, selective medium, the virulent factors, the clinical manifestations, diagnosis, and treatment. Coming to the introduction, as you all know, the introduction will be it is a positive bacteria, gram positive, cocci, arranged in chains, and also its catalase negative. Belongs to group A of beta hemolytics. And the very important thing about this bacteria is that it possesses a capsule that is made up of hyaluronic acid. That's very important to know about these Streptococcus pyogenes. So with this, our first part, that is introduction, is over. Now coming to the selective medium. So in selective medium we have PNF. So PNF is a short form for various antibiotics. The first one, P, stands for polymyxin, N stands for neomycin, and F stands for fusidic acid. These all are antibiotics. So selective medium, as you know, it inhibits the growth of some bacteria and promotes the growth of another. So it's very little of knowledge that you know that in this case the inhibition is of some other bacteria and the growth is of the Streptococcus. So there is a growth of Streptococcus pyogenes or group A beta hemolytics, and there is a decrease in growth or inhibition in the growth of Streptococcus aureus or any other bacteria. So another selective medium for this is crystal violet blood agar. So these two media are selective media for Streptococcus pyogenes. And very important property about these Streptococcus pyogenes is that it produces a pinpoint colonies. It produces a pinpoint like colonies. And the last thing about these bacteria is that transport medium for Streptococcus. The transport medium is Spike's medium. So with that, our selective medium portion is over. So our introduction is over and selective medium portion is over. Now coming to the virulent factors. Our third topic is virulent factors. In virulent factors, the first factor is exotoxin. So the exotoxin of Streptococcus is erythrogenic toxin. It's also known as Streptococcus beta hemolytic toxin or Streptococcus pyogenic exotoxin, SPE, Streptococcus pyogenic exotoxin. And it's a super antigen, so it directly binds to the T cell receptors, and it causes a very important thing that you need to know about for the MCQs, that is, it causes scarlet fever. When scarlet fever comes in any MCQ, the cause is Streptococcus Pyogenes. And scarlet fever has some characteristics that are described in the picture, like sandpaper rash, strawberry tongue, and pastia lines. So the pastia lines are nothing, just the lines in the skin fold. As you can see, there's an elbow and there is a skin fold, and these lines are called pastia lines. And strawberry tongue, as you can see, the granules of like strawberry, the strawberry tongue, and sandpaper rash you can see by yourself. So this was very important slide and some pictures. Now coming to other virulent factor, that is enzymes. So the enzymes here are streptokinase and streptodornase. Streptokinase and streptodornase. And what these enzymes do is that it facilitates the bacteria to break thrombus. So for example, this is a bacteria in a blood vessel, and its way is interrupted by any thrombus. So what the bacteria does, so the bacteria secretes these streptokinase and streptodornase, and with the help of these enzymes, there is a thrombolysis going on here. The thrombus breaks and makes the passage easy for the bacteria. So this is a very important enzyme, and clinically we use it. So clinically we use it for myocardial infarction and deep vein thrombosis. You might have heard about the enzyme streptokinase in MI. So MI and deep vein thrombosis. Another enzyme is hyaluronidase, that's also known as spreading factors. As discussed in the previous session, it acts as a drill and makes the passage easy and helps the bacteria to spread. So all you need to know about the hyaluronidase is that it's also known as spreading factor. Coming to yet another important virulent factor is the proteins, a group of proteins, basically M protein, T protein, and R protein, and I'll write it as MTR protein. It's not the same, it's different proteins: M proteins, T proteins, and R proteins. And important among them is M protein. It's antiphagocytic basically, and there was a scientist named Griffith, and he classified these M proteins into more than 80 types. So it's known as Griffith's typing. So what he did was he typed the M protein 80 times. So from M1, 2, 3, and it goes up to the M80. So our virulent factors we have completed 3 virulent factors: exotoxin, enzymes, MTR proteins. Fourth one is streptolysin O. Streptolysin O is immunogenic. What does immunogenic means? It helps in the production of antibodies. So if antibodies are produced against the streptolysin O, what it indicates is that the person is having a recent infection. So if antibodies are produced against the streptolysin, it indicates that there is a recent infection. For example, you can say clinically as ASO greater than 200 Todd units, so it signifies a recent exposure. And ASO is nothing, just abbreviation for antibody to streptolysin O. So with that, our virulent factors are over. So in virulent factors we discussed about exotoxins, enzymes, MTR proteins, and streptolysin O. Coming to our second last thing that we are going to discuss are clinical features, a very important topic. So here's a very peculiar features about these Streptococcus pyogenes is that the structure of bacteria, the structure may be M protein, carbohydrate, cytoplasmic membrane, or any other thing, that it mimics like our own tissues that are found in our body. So as you can see, the bacteria, it mimics like some of the tissues in our body, like heart or maybe synovium. I've drawn a bone for it, and you should understand heart or synovium. I will draw a chart, and on the one side of a chart there will be bacterial component. On the next side will show what it mimics like. Okay, so when the antibodies are produced against the bacteria, so it also attacks it cross react basically and attacks our own cells, our own tissues. So it is a type of an autoimmune attack, you can say. So autoimmune attack. So the chart goes like this. On the first side there is bacterial component, and on the right side I will show our body tissues or what it mimics like. So the first component I'll write is M protein that we discussed in the virulent factors, and M for M proteins, and it mimics like myocardium. So I'll show this as an antibody against the normally M protein, but it cross reacts and attacks the myocardium. So the second component is carbohydrates, and C for carbohydrates and C for cardiac valve. So when an antibody is produced against the carbohydrate, it's also produced against the cardiac valve. The third one is cytoplasmic membrane, and it mimics like the vascular intima. Another one is hyaluronic acid, and it mimics like synovium and acts on joints, cross reacts basically on joints. And the last one I'll write as peptidoglycan, and it acts on, it mimics like skin. So if antibodies are produced against the bacterial component, it's also produced against some own body tissues like M protein for myocardium, carbohydrates for cardiac valve, for cytoplasmic membrane, and also for all these things. So this was a gist, but clinical features are yet to be discussed. So basically, when there is a lesion, we categorize a bacterial lesion into suppurative and non-suppurative lesions. The one side will be suppurative lesions and another will be non-suppurative lesions. So the term suppurative means a disease or a condition in which there is a discharge, you can say, in which there is a purulent exudate or pus is formed. So suppurative lesions are further categorized into skin and throat. In skin we have impetigo, also known as school sore, and we have erysipelas and cellulitis and necrosing fasciitis. So there's erysipelas, necrosing fasciitis, and there is a necrosis going on in the skin, and that's why we have a name called for these bacteria called they are also called flesh eating bacteria. And with the erysipelas we have cellulitis also. In throat, you should have listened and a common term name as strep throat, a very bad condition. And there is bacterial pharyngitis. This is the most common thing in that. And the last is Ludwig's angina. So suppurative lesions are over. Coming to the non-suppurative lesions, it's very important to discuss and differentiate the non-suppurative lesions. So we will be discussing non-suppurative lesions and also differentiating between them. So it's categorized into, and you should know that there is no pus formation here. Okay, the one is acute rheumatic fever and other is post-streptococcus glomerulonephritis. So we will be describing these two and comparing these two here only. So the acute glomerular the acute rheumatic fever. In acute rheumatic fever is basically a sequel of sore throat. That means the sore throat occurs first, which is followed by acute rheumatic fever. On the other hand, the post streptococcal glomerulonephritis, I'll call it as PSG. So in PSG, it is a sequel of skin lesion, later maybe of sore throat, but the initially there is a skin lesion and then PSG happens. Another thing to note is that the acute rheumatic fever can be caused by any strain. By any strain, I mean the M protein, which Griffith classified as more than 80. So it's caused by any strain from M to 80, it can be any. On the other hand, the PSG it's caused due to the nephrogenic strains. It's M49, 53 to 57, that means 53, 54, 55, 59, M1 and M12. The thing about M1 and M12 is that it's present in both. It can cause acute rheumatic fever and post streptococcal glomerulonephritis. So another thing about the acute rheumatic fever is that it is genetic. Basically it has genetic predisposition, and the PSG anybody can get it. There is no genetic thing going on here. And in acute rheumatic fever, the penicillin prophylaxis is needed. On the other hand, on post streptococcal glomerulonephritis, there is no penicillin needed. The rheumatic fever is a type 2 hypersensitivity reaction. On the other hand, PSG is type 3. So type 3 hypersensitivity reaction. The acute rheumatic fever, in acute rheumatic fever, the complement system are normal, the complement level are normal basically, and on the other hand in PSG there is a decrease in complement. So you all know anything genetic has bad prognosis. Similar is the case with acute rheumatic fever. There is a bad prognosis, and post-streptococcal glomerulonephritis has good prognosis. And in PSG there is a very famous saying that if someone has three things basically, one is puffed face, second one is sore throat, and cola urine, the one thing that should come into your mind, it should be PSG. The person is most likely to have PSG, puffed face, sore throat, and cola urine, PSG. So with that, our clinical section is over. Now we are left with diagnosis and treatment. Coming to the diagnosis, so we have two things. One is bacitracin sensitivity. That means the bacteria are sensitive against the bacitracin. So bacitracin is an antibiotic. And another one is PYR test or PYR test. So its full form is pyrrolidonyl aryl amidase test, and these Streptococcus pyogenes are positive in this test also. It's a very important test, and I'll be discussing this test in very shortly in brief. So PYR test, its full form is pyrrolidonyl aryl amidase test, or you can say PYR test. So basically, it's a chemical, and bacteria contains pyrase. Pyr is a chemical, and bacteria contains pyrase. I'll share a picture with you to make it more clear. So this is a chemical pyr, and the bacteria contain pyrase. So what the pyrase does is that it breaks the pyr into beta naphthylamine and pyroglutamic acid, and subsequently beta naphthalene gets converted into a precipitate which is bright red in color and helps to distinguish between some other bacteria and Streptococcus pyogenes and also Enterococcus. So this pyr test is positive for two bacteria, Streptococcus pyogenes and Enterococcus. As you can see in the picture, there is a slide which shows red color, and also on the test tubes there is a negative color and positive pyr test, which is by forms a red precipitate, is for two bacteria only, Streptococcus pyogenes that we are discussing today, and also Enterococcus that we will be discussing tomorrow in the next session. So coming to our last topic in today's session is treatment. So treatment is very simple. We give penicillin, and if there is any allergy or resistance, we give cephalosporins. So this was it about Streptococcus pyogenes. So our part 1 is over. So in the part 2 we will be discussing about GBS, that is group B Streptococcus, and Streptococcus viridans, Enterococcus, and a chunk of Streptococcus pneumoniae.